I'm Kyle Martin, and I'm an orthopedic surgeon here with CentraCare M Physicians Orthopedics. And my area of specialty is orthopedic sports medicine, primarily focused on knee, hip, and shoulder. The first time you do anything, you find it interesting. First rotation was in cardiology, and I thought I'd be a cardiologist. And then after that, I was on to something else. And then the orthopedics one, I said, hey, this is where I belong. For one, I think the immediate gratification of surgery. You can take something or someone who's struggling and has an injury, and you can make it better. But then it's more of the long-term following patients and seeing how they're doing and getting them back to the activities they want to do and need to do. And just sometimes the genuine gratitude they show when they come back and you're able to restore that quality of life. That's why we do it. What we're building here, the idea is to bring in fellowship-trained, subspecialty trained orthopedic surgeons who can really just deliver a higher level of care, more similar to what you might have to traditionally go to a more centralized facility for. So the idea is to keep patients from central Minnesota within central Minnesota. Clinically, certainly we have our mentors and peers down at the university, so although we were 3 initially and now we have 8 surgeons, we're not really on an island because we're part of a bigger network of physicians and surgeons. So we can bounce ideas off each other and also just foster continuing learning and staying ahead of the curve on surgical developments and technique trends. And then there's the academic side of it too, so getting involved in education, whether that's medical students, physician assistant students, residents, fellows, that kind of thing, and then research-wise. One of my fellowships was over in Norway, working with the Olympic athletes and their national level athletes, and getting to know a lot of the surgeons over there. And they actually had the first knee ligament registry in the world. And so I got pretty intimately involved with the database and how they track their surgeries, their patients, and their outcomes. And then mixing that with my second fellowship, which was down at Mayo Clinic, where I learned a little bit more about some artificial intelligence and machine learning, how we can use that to predict outcome for future patients based on past patients. And so bringing the two together kind of seemed like a natural fit. So early on, I'd say within the first probably 6 months of starting here, I was able to receive a research grant. And we've basically been able to publish a few predictive algorithms so that a patient who comes into the office with an ACL rupture, for example, as a clinician, you can punch in some of their information and give them a more specific risk of failure or risk of their outcome, essentially, which is kind of novel, using some new techniques in, again, the artificial intelligence and machine learning world. The biggest thing is just grow something special here in central Minnesota, and especially getting in at the ground floor. It's been kind of nice to see the vision develop and moving towards it, what we've managed to accomplish in growing the team and moving forward. I think the biggest thing is just moving forward, looking forward where we're going to be in 5 years, 10 years, and building something special. And part of that too is just getting into the community, working with some of the for me, in sports medicine, high schools and collegiate athletes. We are partnered with St. Cloud State now, so I will be team physician for their athletics department, including all of their sports. And so it's going to be exciting to be a part of that, which is brand new for us this year.